1:05. There's still some folks kind of trickling in through the waiting room, but we're going to go ahead and get started. So welcome and thanks for joining us today for a very exciting campaign launch. After many months of preparation, we're excited to officially be soft launching our I Vote for Public Healthcare campaign with all of you today. The official public launch and release of our platform and campaign is going to follow later this week. But you all get a sneak peek for being here today. So if you don't know me, my name is Audrey Gay. I use she, her pronouns. I'm the lead organizer with the BC Health Coalition, and I'll be kind of emceeing us through today's call. To kind of get us started, before I kind of dive in, I'm going to just run through some tech housekeeping notes. So just a note that we are recording this meeting and it's going to be posted on our website. So I'll encourage all of you to manage your privacy as you feel comfortable by either turning your cameras on or off, or changing your name on Zoom if you don't wish your name to be readable. It's not usually very readable on a recording, but I'll let you be the judge of your comfort zone. The person to send a message to is called Tech Host in the chat. So just it's our colleague Angus who's online and taking care of all the tech business. So if you're having some technical difficulties or you have some questions you want to get in touch with the Health Coalition staff, shoot Angus a message at Tech Host in the chat. We have chosen to leave all the participants on mute until the Q&A discussion at the end of the meeting. Please feel free to save your questions or comments until then, or put them in the chat and we'll try to bring them back later so you don't forget them. And that's just so that we can minimize background noise and help with the quality of the recording. And then finally, the chat is there for you to use. We do ask you to keep it polite, respectful, and on topic. And just note that because it can be really distracting to be a speaker and watch a chat at the same time, the speakers aren't necessarily going to be keeping their eyes on chat, but we'll hopefully bring back those pieces in discussion later on. So I think that's it for the tech housekeeping. I do want to ground us in a land acknowledgement before we dive in. The BC Health Coalition acknowledges that we're based on the unceded and traditional Coast Salish Nations territories of the Musqueam, Tsleil-Waututh, and Squamish Nations, and acknowledge the many territories and lands across Turtle Island that you're all joining us from. We are honored to be here as guests on this land that Indigenous people have cared for and continue to care for. And we know that we're all joining from different places today, so we invite you to take a moment and think about your relationship to the land, where you're located. And if you would like, please use the chat to let us know. This is a part of our ongoing work to reflect about the ways that healthcare has been a tool of colonization in many ways. And we start our meetings by reminding ourselves of that. Hopefully, if you're here, the Health Coalition is not a complete new concept to you, but just for the sake of formality, we are the BC Health Coalition. We were started, I believe the date is 1994, with the goal of defending our healthcare system against privatization attacks, expanding Medicare, our public healthcare system, to improve access and healthcare for all, and advance evidence-based public solutions on healthcare issues. And really, that's all of those goals are really woven into this campaign that we're launching today. So hopefully you'll be able to recognize that. Really quickly, our agenda for the day, we have three main sections that we're going to work through. The first is going to be taking a look at our 6 solutions. This week we're launching our platform for public health care and highlighting 6 really important solutions that can be implemented swiftly with a new government, or at least initiated swiftly, and that could really make a big difference across the whole healthcare system. So my colleague Andrew is going to present those 6 solutions for us today. And then we've got the fun part of the meeting. We've got a fun game show prepared for you, and we'll say a little bit more about that, but you'll get to play along with some volunteer contestants that are bravely agreeing to be put on the spot for all of us today. And then before we wrap up with some calls to action, we're going to do a bit of a deep dive onto one of the campaign components that we're asking as many people as possible to take part of today, and that's going to be approaching candidates in your ridings and asking them to support our 6 solutions. We'll say a lot more about those shortly. So I think that's it for my intro slides. I'm going to introduce my colleague Ayendri now. So Ayendri is the Director of Policy and Campaigns at the Health Coalition. And she's going to be talking about our platform and our 6 solutions. Really, this is the culmination of a lot of months of work, including, some of you may remember earlier on in this year, the process of having listening campaigns, but getting groups of people together at the Health Coalition in your own member organizations, if you participated in that, and listening to people's stories about access in the healthcare system, and then months of consultation with healthcare experts and researchers and people on the front lines. So it's really the result of a lot of good work. So I think without further delay, I'm going to hand it over to Ayendri to share.
Thank you, Audrey. I do have slides and I will just, sorry, go to slide. Sorry, I'm having a bit of trouble with my slides at the moment. You know what, I'm gonna just stop sharing and I'll speak to you about it and then adjust. Okay, so as Audrey mentioned, we are the BC Health Coalition. We are a BC-wide, nonpartisan, non-for-profit coalition of community members, healthcare workers, researchers, community service providers, and grassroots groups. We base our policy positions on peer-reviewed research and our mission to strengthen and defend the public healthcare system. As a nonpartisan organization, we are launching a platform that puts public healthcare and the people who rely on it first. For-profit healthcare lobbies continue to drain our public healthcare system of resources, fracture services, and oppose real solutions. It doesn't have to be this way. This provincial election, we don't have to choose between band-aid solutions and continue an unbearable status quo or quack ideas that make things worse. Together, we can get better healthcare. So we are demanding that the parties move past slogans and let us know where they stand on these 6 priority commitments. These, as Audrey had mentioned, these 6 practical solutions are vital to building a better vital steps to building a better quality public healthcare system that is accessible to all, and that ultimately will save you and the government money. And so just to mention about these 6 solutions, you know, they are separate, but they're all really connected. And a lot of the issues that we see in the healthcare system are issues that are like structural to different pieces of the healthcare system. So we'll see issues in one service area that will impact like staffing shortages in another area. And so these 6 solutions are really vital steps to building an overall better accessible, better quality, and more affordable healthcare. So Now I'm going to try this sharing again. Let's see if it works out. Okay, so the first solution is guarantee access to ongoing primary health care. So to do that, we're asking parties to commit to developing a global funding model that funds primary health care like we do hospitals and schools, and offer it to all new and current community health centers, First Nation health centers, and boundary centers, and establish one new center per year in each health authority until every community has access to one. The benefits of this. Family physicians are able to stop running small businesses and focus on providing care. It allows providers to know patients' health histories and results in better care, consequently decreases the burden on emergency and hospital services. You will hear me repeat that last part of the sentence almost throughout this entire um, um, slideshow, but basically when providers know your health history, it means more accurate diagnosis, more less unnecessary tests, and overall means that health, like your health is not increasing to need as much acute and hospital care. This also allows patients to find primary care in their area in the same way you would find a school for your child. And these one-stop shops of integrated services provide better access to care to communities that usually have less access. So if you think about that kind of one-stop shop of like having your dentist, having your primary health care, having, your physio, and all of these integrated services in one center, that means better access to rural communities, that's better access to folks who have limited time, like single parents. It's been proven to give better access to migrants and First Nations communities due to these kind of integrated services with social services as well. And so I'm going to move to the next solution, which is provide coverage for medicines that people rely on and fully implement a publicly funded, universal, single payer, and first dollar pharmacare program at the earliest possible opportunity. And so again, medication is the second largest part of our healthcare system. We are the only country, OECD country with a public system that doesn't also cover medications. And there's some really rational parts of why we should be doing this. So one piece is right now it's been shown that 1 in 4 people can't actually afford their medication, often pushing people to have to decide between their paying for groceries and putting food on the table or their medications that they rely on. And that means that they might ration or cut doses, consequently, again, burning the emergency and hospital services unnecessarily. So providing access to medications reduces the impact on those services. This integrates the second largest component of our healthcare system into the rest of our healthcare system. So that makes it a lot easier and more streamlined, and again, decreases administrative burden. And this is one of the probably the most practical part of this is it allows the government to negotiate lower drug prices, and supports something kind of called, we refer to as bulk buying, because it's basically, that's what it is the government's able to buy drugs and then kind of negotiate those drug prices down. And this is a conservative estimate. It saves the public money, like $5 billion in money. Employers save by not having to pay for coverage through benefits, possibly allowing them to expand coverage in other areas. This is one of those policy planks that is supported across the board, except for the pharmaceutical industry and the private insurance industry. Like, other than that, it has a large, widespread support. And so, I'm trying to read my own. Create more public, sorry, I can't see that. Um, uh, rapidly reduce surgical wait times by creating more public capacity and efficiently managing wait lists through a first available surgeon model. And so these sorts of public sector innovations are incredible. And it's incredible that there's so much propaganda out there that suggests that private solutions would be effective when there's actually no evidence of private solutions ever reducing wait times effectively. Actually, here in Canada, we've had multiple provinces attempt to expand private surgical clinics, with them all failing. And that's across the board. Whereas public sector innovation, like a first available surgeon centralized wait list, has been proven to reduce wait times by 89%. Almost every time it's implemented, it reduces wait times. And that's, actually it's pretty logical if you think about it. If you needed a taxi cab, and you, instead of calling an operator who told you, who like sent the next available cab who was closest to you to get you, instead you had to call every individual cab around the city to find if one is close by and if one's available. That could take a day, or you could get lucky and it might take an hour. But it's a lot of unnecessary time. So this is exactly what a centralized wait list does. It just allows us to know which surgeons are available, and allows us to assess and triage resources more effectively. Um, Added benefits is it does not compromise our public system by entrenching those private for-profit providers into it. It takes off the burden of, imagine if it is your responsibility as a family physician who has to call up all of these specialists and surgeons' offices. It takes off the burden from their offices in doing that as well. So improve access and quality of seniors care, expand access to publicly funded home support, and eliminate the financial barrier of the current regulated daily rate copayments. Raise the standard of care provided in long-term care by requiring all facilities that receive public money to be a part of a public sector master collective agreement. Now, when I had said that investing in these solutions you'll hear me repeat how much this takes off the burden off of emergency services and hospital services. Seniors care is one of those places that this is dramatic. Right now, and this is in BC, our hospital beds have been shown to have about 18% of our hospital beds, which a lot of our hospitals are actually operating over 90% in capacity. 18% of those beds are taken up by patients who can't be discharged because of lack of seniors care, especially home support. It's, doctors or social workers can't discharge a patient knowing that they won't have the adequate care to continue supporting their health. And so that's like 20, that's 1/5 of our hospital beds. That's a huge decrease. It also means it prevents falls and from seniors' health deteriorating more rapidly and needing access to those hospitals. Again, it's extreme. It means less surgical wait times because of the prevention of like unnecessary injuries. And I mean, I could probably keep on going on just the amount of benefits of home support just alone. But one of the things that we're also seeing, the BC Coroner's Office has recommended that an increase and supportive plan of home support as to address increased extreme weather events. This is because those who home support clients and who should be folks who should be accessing home support are the most vulnerable to dying during extreme heat events. And just having somebody be able to check on them safely, and having those workers work in safe conditions, work in and be able to be effective, and having a plan in place will actually reduce deaths during extreme weather events. And not only to mention that it this is a part of a care economy that doesn't increase our burden on fossil fuel intensive industries. It is a part of an economy that actually decreases it. It and of course not to forget to mention how investing in this will relieve caregiver burnout, which is extreme and very gendered. And so, oh, there. Um, Protecting public funds for public health care. Um, you know, fully enforcing the Medicare Protections Act and phasing out for-profit and corporate providers that are draining public funding away from public health services. So there are two types of privatization, and you might actually learn a little bit about that in the game that is prepared. But there is privatization that's considered illegal under the Canada Health Act. And that is, a lot of the time, the result of that is, forcing patients, vulnerable patients, to pay out of pocket for services that are actually covered under our public system. And every year we are clawed back about millions of dollars um, of federal funds due to not actually fully enforcing the Medicare Protections Act. And that's funding that should be directed towards our services. So if the province is not in line, and this happens across the country, the federal government will claw back transfers, which is a part of the function of the Canada Health Act. So that's direct privatization. Indirect privatization, which is a really large part of why we are in the crisis we're in today, is that over the last 20 years, we've seen this kind of sneaky type of privatization that is technically legal in our system, which is an increase of contracting out and private-public partnerships. This sneaky type of privatization, which means that we are contracting out the delivery of public services to for-profit providers, has been slowly draining our system of resources. For-profit providers are very creative in finding ways to keep as much of that public funding for profits rather than spending it on services. One of the issues with contracting out is that there's little oversight because these for-profits are able to use intellectual property right laws to actually stop us from understanding if they really delivered those services. If there's a lack of transparency in ever knowing if we've paid them for services and if how they actually spent their funding. And when they kind of become a part of the system, they really find ways to entrench themselves into the system. If that is, buying up resources or sharing ownership of resources and then renting it back to the public system for exorbitant prices. And again, how this impacts those acute care services are, when we're thinking about private surgical clinics and services like that, they're really draining staff away from our public services because staff can't be in two places at once. Okay. And so create sustainable working conditions for all healthcare workers. So increase opportunities to work in salaried, multidisciplinary, team-based care, and implement a bottom-up workforce plan that starts with the lowest paid workers and moves up the system. There's both of these items, so really support the entirety of the continuum of care of our services. We know that workers who are working in contract environments are more precarious, and it also impacts the ability for them to be able to provide dependable care. Multidisciplinary care allows care that actually addresses the social determinants of health, and it means that this team-based care is This team-based care also creates stability. It allows healthcare professionals to take holidays, take sick leave, retire more easily. This includes doctors, and it continues providing patients with high quality care. Then that other piece of the workforce plan of starting with a bottom-up approach is that we see that the top healthcare professionals continually, when they get wage increases, and this is, we're talking about surgeons, they actually it usually means that they work less. Not usually. That is actually a principle. It's something that we know, that when we pay doctors more, they often they actually work less, and that actually points to it's the conditions of where they're working, that they'd rather have a work-life balance and a better way of working than just increased pay. And so starting a workforce plan that starts with fair, equitable compensation for the lowest paid workers who are often very precarious and unable to, and who we rely on to provide some of those essential services like home support, which again, I mentioned how many benefits it has. That will actually create a foundation that allows teams to continue to operate and work, and it has benefits of, like, across the system. So if we start with a workforce plan that starts and does assessments and creates equitable work places for the lowest paid healthcare professionals, it will create it will support the entire system and be much more impactful. But like that very important goal of creating sustainable working conditions is reliant on having team-based care that's multidisciplinary. And that actually also increases overall job satisfaction, which is very important to satisfaction. Very important to retention of our workforce. So I'm going to stop sharing. And I think there'll be some time for questions afterwards. Am I correct, Audrey?
Yeah, that's good. Yeah, please save your questions. We're going to have a big discussion and Q&A at the end of the meeting. So jot them down so you don't forget them, and we'll bring Ayandri back for that. Thanks so much, Ayandri. That's the first part of what we're launching today, is our 6 solutions and a more in-depth platform later this week. I'm going to put a link in the chat, and some of you will have already seen our vote pledge. It's just been updated today to include those 6 solutions right in the pledge, as well as a link where you can download a 2-pager that is just a really quick summary of those 6 solutions. So feel free to go over to that web page. If you haven't signed a pledge yet, please sign it. Please share it with your friends and family and members in your organization if you're an organizational member. We're also going to be sending out later this week a partner toolkit. So if you are a member of an organization, you'll have everything you need to share that pledge out with your members. But yeah, like I said, there's a really handy 2-pager you can download on that page that summarizes really well those 6 solutions that Ayandri just mentioned. So we'll move on soon, very shortly, to our game show, but I just wanted to give a bit of a sense of how the game show kind of connects into with this campaign. And so in a couple of weeks, we'll be putting together and releasing a report card that will assess the political parties, the official political parties, healthcare platforms and positions, and give you a sense of where each party stands when it comes to commitments towards our 6 solutions. So in order to do that and to explain really clearly why we would say that something a party suggests is good or bad, we've actually created a ranking tool that has 5 categories. And so those 5 categories, Megan will explain them in a moment, but they essentially are a way of saying, you know, this is a good solution, this is a great solution, this is not a solution, and hopefully in a way that that kind of it will be easy for the general public to understand. And so what we're doing with this game show is putting some brave volunteers on the spot, and we're going to ask them to put this ranking system to the test. So Megan's going to throw some scenarios at them, and they're going to do their best of applying the tool after we've presented it to all of you. So thank you so much to our contestants who will be on shortly. And I think over to our game show host, Megan Milton.
Hello, welcome to the quiz show. I'm your host, Megan Milton. Just making sure I'm sharing the correct screen. All right, what are we looking at? Yes, perfect. I'm Megan Milton. I'm the project organizer, and for the sake of this show today, I am also your game show host. So today we're going to be looking at the ranking criteria we've got going on right now. So just like a quick overview here right off the bat. This is our rubric that we'll be going off of. So healing solutions, infusions, band-aids, quackery, and poison pills. iEntry's worked really hard to come up with a scoring system that's engaging and accessible to the general public. So let's look in detail at what we got going on. So starting off with a healing solution. This is a transformative system improvement that can help cure the crisis in our healthcare system. These are policies that protect and enhance and expand the public healthcare system. Infusion. Infusion is an infusion of resources to the public healthcare that increases capacity of services. This can be investments in workforce, infrastructure, and services in general. Our next option is a Band-Aid. This is a favorite of politicians all over the world. It is a system that will make small improvements that seem to work right off the top, but you'll notice that they actually exasperate the problem over time. Moving on to quackery. This is a pseudo solution that drains resources and makes services worse. Things like sneaky privatization, cuts to services, and general misinformation. And finally, we have the poison pill. This is a direct attempt to kill services that will result in unequal US-style healthcare. This is privatization that is illegal under the Canada Health Act. It's malicious and it's everywhere, and we're here to stop it. Let's look at the rules. So contestants are going to buzz in. Now, we didn't have the budget for buzzers, so they will be just saying buzz. And if they're wrong, the other contestants will have the opportunity to steal the question by buzzing in as well. And at the end of the game, the points are going to be tallied, and the winner is going to receive a very fancy umbrella in the mail. Please don't leave it on the bus. Let's introduce our candidates, though. Like starting off the top, we've got David Ravensburg. I understand that you recently opened a gluten-free bakery.
That's not entirely accurate. I am very happy to be here. I'm calling in from unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. I'm the Pacific Regional Organizer with the Council of Canadians based in Vancouver. And I just wanted to give a quick shout out to all the handy dart drivers in ATU Local 1724 who just ratified their contract yesterday and are a key and often overlooked part of our healthcare system.
All right, welcome David to the game show. Our next contestant is Sheila Moyer, who collects haunted porcelain dolls. How are you doing today, Sheila? Oh, hold on. Oh, Sheila, you're muted. Oh, there we go. Sheila.
I'm good now, am I?
Yes.
Oh, fabulous. Hi, I'm Sheila Moyer. I'm my pronouns are she and her, and I'm joining you today from the unceded and stolen territory from the Musqueam and the community now known as Steveston. And so do I collect porcelain dolls? No, but I have a really good story, which is way too long to talk about today about a porcelain doll, a scary one.
I don't know where I'm getting this information, Sheila. Your next contestant is Agnes Jackman, who recently backpacked through the Florida Everglades. Is that one true, at least?
No, but it is on my bucket list. So, yeah, I'm participating from the traditional lands of the Kaikite, the downriver speaking Salish First Nations people, now known as New Westminster. And I'm an individual member of the BC Health Coalition, as well as being here representing BC Forum, that's the BC Federation of Retired Union Members, and Costco, that's the, not Costco with the T, but Costco, the Council of Senior Citizens Organizations, and both of these organizations are members of the BC Health Coalition. I would like to make a shout out to all the wonderful public healthcare supporters I know, and all those I don't know too, and hope to know at some point. So that's it.
Fantastic, Agnes. We're happy to have you on the show, and I feel like my information has been really bad, so this might not be right. But our next contestant is Sasha Burton, and she's the digital media manager at the BC Poverty Reduction Coalition. Is that one true?
It's true. How'd you know?
There we go. The intern got it right. The intern is my dog. Okay. But you know what? They're not the only ones playing. Everyone here in the webinar today is going to be playing along. When a question is asked the contestants, a quiz is going to pop up on your screen. And at the end of the show, we're going to look and see how the meeting participants did as a whole. So let's get started. Starting off, are the contestants ready? Are we all ready to go? Are we all unmuted?
Absolutely.
Everyone is all muted and ready to go?
Yep.
Perfect. Let's get started. So our first category is primary care. This is not just about family doctors. A lack of access to primary care affects our ability to address our healthcare needs before they become an emergency. So let's look at a couple of scenarios that could be happening. Our first scenario is improving access to primary care by extending the role of tech telehealth companies. Contestants. Buzz, that's going to be David Ravensburg. What's your answer?
I'm gonna go with poison pill.
Poison pill. That is incorrect. Can someone else buzz in?
Beep beep.
Buzz.
Looks like we've got Sasha.
I'll say that's a Band-Aid.
Band-Aid. That's incorrect. Anyone else want to give it a go?
Buzz.
Quackery.
All right, Agnes.
Quackery. Quackery.
Quackery. You are correct. Well, it may seem like a good quick fix to primary care crisis. Contracting out private telehealth companies results in more primary care being sorry, the quiz keeps popping up in front of what I'm reading. Well, it may seem like a good quick fix to the primary healthcare crisis. Contracting out to private telehealth companies results in more primary care being taken over by the private sector, and this is draining resources away from our public infrastructure rather than building the primary care system we need. Why doesn't it work though? While telehealth can be an important tool to improve accessibility in primary care, the recent expansion of virtual health companies has not improved access to the gold standard of longitudinal primary healthcare. But virtual care companies are attracting doctors by offering to take on the business side of primary care, which is actually really good news. Let's look at our healing solution. Our healing solution would be to have our primary healthcare system needs better addressed with public infrastructure that allows family doctors, nurse practitioners, and a full primary care team to focus on providing patient care, not just running a business. By fully funding this team-based care, we can create community healthcare centers that could guarantee access to primary healthcare in every community. Moving on to the next topic, we've got home support. All right, so our first scenario is, oh, my presenter notes are not popping up correctly. Let the market provide more options for seniors to hire their own home care and home support employees while offering subsidies to those who need it the most. Let's get going. Yep. That's going to be Sasha.
I will say that's a poison pill.
All right. Anyone else want to give that a go?
Quackery. Agnes.
That's quackery.
Agnes for
Quackery.
quackery. That is correct. This approach leaves home support services in the realm of private industry, which is never a good thing. Not all seniors are going to have the ability to hire home support, and it doesn't recognize that home support is an essential part of a highly functioning public healthcare system, and it fails to invest in the public home support that we need to see the benefits to cut down emergency room visits, wait times, and long-term care capacity. What is our healing solution though? Not everyone can afford private home care service. And even if private home support was partially or fully reimbursed, an unregulated private home support market means that care workers will continue to be in precarious and unreliable and exploitative working conditions. And this predominantly affects a female and racialized workforce. Evidence shows that private companies make profits from cutting wages and the quality of care. Conditions make it really difficult to recruit and retrain well-trained, compassionate workers to provide the long-term relational care that we want for our loved ones. So there is a much better solution out there, and we're advocating for it today. Our next category is protecting public funds, investing in public, protecting public funds. So our first scenario is increase access to diagnostic imaging services by allowing people who can afford to pay for private tests out of pocket.
Buzz,
What about Agnes Jackson?
Buzz, Band-Aid.
Band-Aid? Okay, that is incorrect. Do we want to Buzz? David Ravensburg.
I'm gonna call it a poison pill.
And you would be correct.
Oh.
Under the Canada Healthcare Act, BC Medicare Protection Act, it is illegal to pay for faster access to healthcare, including faster access to diagnostic services and imaging services. For-profit providers are costing the province millions of dollars a year. BC is being penalized every single year for failing to fully enforce the Medicare Protections Act. And private for-profit providers have illegally billed BC residents over $100 million since 2016. And the federal government claws back every dollar that is reported. This results in millions of dollars of federal funds being held back that could be going to improving services. So that is why that is a poison pill. But let's look at the healing solution. What is going to be able to fix this problem? Oh, all right. Well, the healing solution would be to protect the medical. Looks like there's something wrong with this slide. We're just going to scooch on past. Our next category is surgical wait times. Let's look at the first. Oh my goodness. Okay, so many pop-ups. Let's look at our first scenario, our next scenario. Reducing surgical wait times by offering contracts to private clinics to provide publicly paid for surgeries. Does anybody want to buzz in?
Poison pill.
It looks like we've got Sheila was the first person to buzz in.
Poison pill.
Poison pill. That is incorrect. Does somebody else want to go?
Buzz Factory.
Agnes, quackery, and you would be correct. Agnes is absolutely killing it in this game. Quackery. Oh my goodness. Okay. Even when private clinics are publicly funded, evidence shows that they deliver lower quality care and cost more to the public, and they don't actually help with wait times. Plus, with our limited pool of healthcare workers, when they're recruited to work in the private system, it leaves the public system understaffed and under-resourced. So what's our healing solution? Our healing solution would be to implement tested solutions to improve access to the public system, like expanding one-stop patient assessment teams and fully utilizing public operating rooms and adopting a first available surgeon waitlist management model. Okay. Our next topic is pharmacare. Let's look at our first scenario. Provide free universal single payer access. I'm going to read out the question first for the sake of it. I know you got really excited. Provide free universal single payer access to diabetes medication and prescription birth control. Sasha.
That's a healing solution.
That is a healing solution. I know I probably should have let everyone buzz in, but you hadn't had a chance yet, so I was being really nice. The original plan for Medicare included public universal single payer pharmacare because that's what Tommy Douglas recognized, that the system we benefit from providing access to education medications rather than having a patchwork of people who end up getting hospitalized when their conditions become more advanced down the road. So that kind of wraps up. Oh no, we got one more. We got workforce. First workforce scenario. is we want to grow the public healthcare system, public healthcare workforce by increasing education seats and reducing the financial barrier for education. Does anybody want to buzz in and give this?
Healing.
That's healing.
Healing.
Oh, that was, does somebody else want to weigh in on who buzzed first?
Infusion.
Infusion. Let's go to tech host Angus for the judge. Who do we think came in first?
I was concentrating on doing the quiz. David spoke, so let's
do David. All right. Okay, David, what's your answer?
Infusion.
Infusion, and you would be correct, David. This is an infusion. Increasing funding for training seats in specific programs like the Health Careers Access Program is extremely helpful for growing our future workforce, but it's not a healing solution. So let's look at what our healing solution is. Our healing solution would be to do that, but also make sure that we're investing in our existing workforce so that we can continue to grow and retain medical staff for the coming years. All right, so that wraps up our questions, but let's figure out who was the winner. And I was not the one keeping score, so let's see which staff member was the one who, Audrey, who won?
That was me. So we've got in first place, Agnes with 3 points. I think the key of this game is being Agnes and saying quackery, and you get it right. Second place, we've got David with 2 points. Sasha is third with 1. And Sheila, unfortunately, had no points, but I'll give her some credit because you were actually accidentally muted for about half that game. So thanks everyone for playing.
Oh no, Sheila. Well, Agnes, you are the proud owner of a fancy new umbrella. Don't leave it on the bus. But let's see how the viewers in the webinar did today. Does somebody want to let us know how our team went?
Lots of people participated. We all are winners by learning about BC Health and people's platforms. And thanks for participating, everyone.
Fantastic. Okay, well, you guys are all ready to identify poison pills and quack solutions this election and beyond. Thanks so much for playing. And that's it for my part of the thing. I'm unsharing my screen.
Okay, well, thank you so much, Megan. I think you get the award for the fastest stalker, which is why we have you doing our TikToks and our social media videos. And if you haven't followed our TikTok account yet, please do so, and you can do more of listening to Megan talk really quickly. Thanks for that. You all put a smile on my face. Thanks for our contestants. So Agnes, we'll be sending you a red Medicare umbrella, or maybe I'll see you in person and bring it to you in person sometime soon. Thanks,
I can pick it up in your neighborhood a lot.
Awesome, I love that. Thanks, Agnes. So, hey, hopefully that was kind of a fun and interactive way to introduce our ranking tool. Obviously, there will be a written version where you can study it if that's the kind of person that you are and you want to learn all about it. And I hope that the polling session wasn't too much of a stress. It was intended to be kind of a fun bonus if you got a chance to participate and not too much of a distraction. But yeah, thanks again for all the work that went into prepping that game show, Megan. Okay, so we're going to move on to our next section, which is talking about our Ask Your Candidates toolkit, action toolkit, and really what we're going to do with all of this, with all of these great solutions and this great platform that we've been working hard on. So now that you know how we're going to be grading BC's parties, let's talk about how we're going to put that together with our platform and build out our report card. And basically, we need you to get involved and help us do that. I see a hand up, but I'm going to remind you that we're saving questions and conversations till the end. So we've created a toolkit that we're going to be using to ask parties and candidates their positions on our healthcare solutions. The Health Coalition staff, we're going to be sending those questions to every political party. But we need all of you to ask all of your local candidates the same questions. So basically, when a local candidate will get these questions from you. They're going to most likely contact party headquarters to get the official party position if they've got one. And they're going to give you that better reply. That doesn't sound that interesting, but why does it matter that you do it? It matters because the more times a candidate gets asked those questions by many BC Health Coalition members, the more seriously they're going to see that we're serious and we're going to hold them accountable for these solutions. The more likely they are to pass them back on to party headquarters and the main campaign, which puts the pressure on them to respond to these to this kind of grassroots demand for responses. And so the more people participate in this process, the more we get clear answers from the parties, and the better we're able to build our report card that we just have a couple of weeks to do. So we want everyone to get on this really quickly and report back. And our goal really is to establish our movement for public health care as one that is organized and active and is going to keep elected officials accountable even after the election. And so we're trying to do more that influence the outcome of this election. In the next few weeks, we're trying to set things up so that we can follow up after the elections when the new government comes in, and no matter who's in power, we're able to follow up and say, hey, remember those priorities that we asked you about during the election? We mean it. We still want you to get it done. So we're going to keep doing that. I'm going to, just if you give me a moment, I'm going to share my screen and show you our work in progress elections webpage looks like if you haven't found it yet. Here it is. Can someone give me a thumbs up if you can see my webpage? It should say Provincial Election 2024. Thanks, Agnes. Appreciate it. Okay, so if you were to go to our website right now, there is at the top right corner of the page a little menu bar, and it says BC Election 2024. And so you'd want to click on that, and it'll take you to this landing page for our provincial election. And then there's a couple of things you can do here. You can click here and see our full public platform. And actually, you can't right now because it hasn't gone live yet, but that's where it's going to go later this week when we do release it. You can sign our vote pledge over here on the right. And if you do that, it'll also take you to a sign up page where you can sign up to volunteer on the campaign. And I'm going to take us on this area here, Ask Your Candidates Action Toolkit. And so there's a few different formats for you to access this. Most of the information is actually included right on this page. And so if you scroll down, you can see that we've got some information about how you can join the action. There's a few steps. The main one that we want you to pay attention to today, this is your action, and we'll come back to it on this call, is to join a local campaign team. So I'm going to open this up, and what we're going to be doing is organizing WhatsApp groups based on regions where you can join a local campaign team. Now, don't get flustered if that doesn't sound like it's accessible to you, because there's other options that I'm going to get through. But the main ask that the main way we want people to get connected and get involved is to join these WhatsApp communities. And you'll see that we've broken up different regions that are predicted to be battleground or swing ridings this election. And so we've got a few ridings in Abbotsford and Langley area, and we've created a group around that. A few ridings in Coquitlam, and we've created a group around that. Same thing for Surrey, a few swing ridings, etc. There's a few different areas of interest that we're keeping an eye on. And so the idea is that you will join one of these groups and connect with other people that live in your local surroundings, and together talk about what you're doing to approach your candidates with questions, what responses you're getting back. We're going to be getting this feedback as you're sharing with each other. Say that there's a local all candidates meeting or debate, you can organize through this group to go together as a team and attend the event together. And maybe you have a plan for splitting up the questions for the candidates kind of ahead of time, so that more of the questions get posed. So that's this first step. If you're not willing or interested or comfortable with using WhatsApp, you can, we've included a few other ways to connect. We're going to be identifying local area campaign captains, and if you're interested in that role, let us know. And that's a point person that we can help you connect to directly. You can also use social media to either send messages directly to our accounts at the Health Coalition or share on your pages, on your accounts and tagging the Health Coalition. Or you can send us an email, or you can sign up for other volunteer roles if all of this doesn't sound like it's accessible and approachable to you, or just not your cup of tea. So that's the first thing that that's kind of important to highlight in terms of the toolkit. Is the most important part is how you get connected to other people. So it's more than you by yourself taking action, but we're doing it together as a community. The second important step is to actually approach your candidates. So we've got here in our toolkit 4 ideas for how you can engage your candidates. The first one is to have a meeting with them. If you're lucky enough to be granted a meeting by contacting their campaign and asking to meet with them, go for it. Go see if you can have 5-10 minutes and sit down with them and see how many questions you can get through with them. If you can get more time, that's even better. If not, we encourage everyone to send an email to their campaigns and ask for written responses back. And so that's really one that the more people that does this and sends that email to all of their local candidates, the more of an impact our work together will have. You can also attend a local all candidates meeting or debate. And we're going to encourage you, if you know of one, and you're part of one of the WhatsApp groups, to share it so that more people know about it, and even us at the Health Coalition can help promote it in your area. And then the other option is to just find out if your local candidate is going to be attending a local event or making a campaign announcement, and you can actually go and attend those events and do your best to find a moment to put some questions to them. So those are some ideas, but obviously in our discussions, in our WhatsApp groups, we're going to be brainstorming other ways to get creative and and talk to our candidates. I do want to say that it's important that you don't just pick your favorite candidate, that you personally support and only contact them, because it's our goal to get to create a report card and to have answers across the board. And so please do contact candidates, even if you think you don't like them and you don't support them. We want all of the candidates in your writings to get these questions. And then the other really critical part of this toolkit is how to report back. Now, a lot of it is just the same thing as joining, as I covered during joining a local campaign team. We want you to be sharing what you learn in your WhatsApp group, on social media, sending us emails. If you're able to, as you're approaching candidates, or if you're at all candidates meetings, if you're able to get their answers on video, that can be really useful for us to get back from you, because we can use that to share on social media, or even pass it on to the press and create some buzz. Especially if some candidates, have some particularly scary positions or answers, that can be really useful in my campaign. So if you're tech savvy like that, I know I'm not always the best with a camera, but if you're comfortable and you can get some answers on camera, we'd love to get those in your report back from you. Now, I'm breezing through this, but the idea is that you can spend some time exploring this page on the website. And there's also a link here that can take you to kind of a one full toolkit document. And so feel free to download that and read through more thoroughly if this formatting is busy to you. I'll just point you to the resources section at the bottom of the page here. So I'll actually open this one here. This is kind of our leave behind pack. And apparently it's the wrong one. So I've just learned I need to update this link. So this is the 2-pager. You can actually provide this to candidates if you do meet with them, because it has on the second page all of the solutions, the 6 solutions that we want them to make commitments towards. But there's also, well, I'll update this link. This is where it should be. The leave behind pack would also have a handy 2-pager with all of the questions for the candidates on it. And the questions are also available here. Let's see if this link here works. Download a printable version. Ah, I did it right that time. So here you go. You can use this little pack, which is just a more condensed version that has just the 6 solutions and the questions for candidates all in one document. I'll put and you can leave that behind with candidates or use this to send it into their campaigns and ask for answers in writing. I think I'm going to leave it at that. If I'm sure if there's questions, we can discuss them during our discussion period. But before we kind of get back to that, I'm actually going to ask Megan to come back. She's the more techie of us on the team, and she's going to say a little bit more about our WhatsApp community and groups and how you can be part of those communities in the next few weeks. Are you with us, Megan?
There we go. Well, first of all, I'm muted. What screen am I sharing right now? Is it looking right? Yes, perfect. Okay. Sorry, I thought I was sharing something sensitive for like a half a second there, and was panicking, but we're good. Okay, so the WhatsApp groups. So I've actually put a QR code on the screen, so you can actually scan this, and that's going to take you to our province-wide group. If you don't have WhatsApp on your phone already, it will prompt you to download it. So this little video is like a screen capture of what it looks like to try and join that on an iPhone, but it'll be something similar on an Android. So you can give that a QR code screen right now if you'd like to. All of that information will of course be on that page that Audrey was sharing. But from there, we have a bunch of different communities that we'll be looking up. So we've got a channel for every single one of the communities. There's a list in there of what ridings we're looking at in that region, but there's also a fun one for chatting. So if you have election memes or you just want to get to know people in the community, we can chat in one of those groups. And then we also have province-wide updates. And then I think one of the most important things for us as well is we've got a channel called BCHC Boost, and we'll be posting shareable graphics from Instagram that we just need people to share within their networks, or maybe it's an article and we're hoping that you'd be able to talk to a neighbor about it. Just things that we want to get out into the community, either through your social media network or, in person, maybe when you're having conversations at church or with your neighbors or at a garage sale, whatever place in the community you're interacting, if you can weasel information about healthcare into a conversation, we would love that. So that's the first thing there. You can take a look. I'll play this video one more time so you can take a look at it. There you go. And then you download it. And then you'll be able to join from there. Perfect. Okay, so moving on to the next thing. I mentioned talking to your neighbors. The other thing we're going to be doing is I'm going to be hosting a workshop on how to have conversations about healthcare. So that's going to be breaking down a lot of the information around our solutions, because obviously we've provided solutions and those are talking points that you can have, but a lot of people don't understand how the healthcare system works already. So we're going to arm you with that information. We're going to arm you with analogies and just kind of give you general information about how to talk about healthcare. And you can utilize that in your day-to-day life. Or if you are out door knocking for a campaign and people are talking about healthcare, you'll be able to have a fair amount of base information about how the healthcare system works. So you feel more confident on the doorstep if you are volunteering for one of those campaigns that does reflect our values as an organization. So you can scan that there, and that'll bring you to the registration page to join that webinar. And I think that's everything that I needed to cover.
I think so. Yeah, let me. Yes, I think so. So we are breezing through a lot of information, and I want to assure everyone that there's going to be lots of very clear follow-up emails with all of these resources and instructions laid out. So this is mostly for inspiration than hoping that you get all of these details at the one part. But there is one more piece that we wanted to talk about. So we've talked about how the biggest part, the most important part of our campaign is to be really clear that we can mobilize a constituency that can raise the bar on healthcare this election and after, and by getting some commitments from all parties. We've talked about how we're going to use our platform and our question guide to send a clear message to all of those parties that we're going to be following up with them after the election. And then the second part of this campaign is actually more short term, and it's working to get the vote out on healthcare. So we know that healthcare has been identified across this province in many ridings, if not most or all, as a priority constituency issue. And we know that British Columbians can be compelled to vote based on healthcare at this point in time. As Ayanji mentioned earlier, we are so well aware as the Health Coalition that the current status quo is not acceptable. And we hear from members every day that feel that after 7 years of a BC NDP government, people aren't feeling the improvements in healthcare that they're hoping for. So that's why we're doing the first part of our campaign. We need to continue building power to raise the bar from every party. But we also have already seen John Rustad and the Conservative Party's healthcare platform, and we know that it's full of quackery and poison pill ideas. So we're really concerned, even as a nonpartisan organization. We feel that those ideas would really put our healthcare system back several years, if not decades. So we don't have time to break down that claim later today, but we are working on some analyses of platforms, and as the report cards come out and those analyses come out, we'll be saying more about that. But we want voters to know that things in our healthcare system can absolutely get worse. Change is not always for the better. And so for those who feel comfortable and who want to be involved in turning the vote out for public healthcare, we're going to help put some volunteer teams together in those campaign areas and support some candidates that are willing to make commitments to healthcare. Now, we're only going to announce who those candidates are once we've done the work of asking them whether they will support our healthcare solutions. So it is nonpartisan. They have to commit to actually fighting for the public healthcare system. But once they do, when there's clear ways that our membership can make a difference, we're going to be inviting people to help support some healthcare champions. So we're planning to, as I said, we don't have a specific date that our report card will be out, but around the time of our report card, we'll be announcing which ridings there are healthcare champions that we feel comfortable supporting and encouraging people to volunteer to get their neighbors and friends and families to vote to make their voting decisions based on healthcare commitments this election. So so it's less timely right now because we want to do the first part of the campaign first, which is that accountability piece, that asking for commitments piece. But I'm going to put a link in the chat to our volunteer sign up page And you can sign up already today if you're not already signed up as a volunteer with the Health Coalition, so that you be sure that we will be in touch with you when we have more specifics around those volunteer opportunities. We are currently, the one important one that we're working on a short timeline to recruit is the battleground riding captain. So as I mentioned earlier, we do want to have some local area captains who can be point people for other volunteers in your area. So if that's something that's of interest to you, and you're interested in connecting other people in your area and seeing what people are interested in doing together, then I'll especially encourage you to fill out that volunteer sign up form today. And of course, we'll be reminding you to sign up for volunteering over the next few weeks as well. I think I will leave it at that. And Megan, I'm going to ask you, if you haven't already, to also put the link to the training, the how to talk about healthcare training in the chat, so that people can have that. But we're going to send that out as well in a follow-up email. So that's a lot of information. But I think that's what we've got in terms of us sharing things with you. Let's do some Q&A. And I think Yandrius should be ready if you have questions about our health positions, or I saw a lot in the chat about climate and the impact on seniors. So maybe that's something that you can start by expanding on. And I'm going to ask Angus to change the settings so people can unmute. We're going to try that, but please do raise your hand and use the raise hand function, because there's a lot of us on this call. So if you're raising your physical hand on video, we might not catch it. But we'll do our best. So we're trying to change the settings so that people have the ability to unmute, and then use your raise hand function if you would like to comment or have a question about really any of the things we've said. And maybe while we're doing that, it looks like maybe Angus and Yandri have been keeping an eye on the chat. So is there anything that's come up as we've been working through things that we should talk about?
I don't know the answer to this, but there was a question on if there was a WhatsApp group for the Okanagan. Was there that we missed?
We have one for the riding that we've identified as the hottest battleground riding is the newly created Kamloops Center. And because Kamloops Center is sort of further away from everything else, we've just created it for that region, or the entire group is just for Kamloops Center.
So, but that's not in the Okanagan. And right now we don't have an Okanagan group, and we don't have plans to have one. I think one of the things we didn't explain is that these groups are based off of some number crunching of what are expected to be battleground or swing ridings. And so those are ridings that came in with a very close margin in the previous elections, or based off of the riding redistributions. Data saying are likely to be close call ridings. So that's kind of the rationale, because we want to direct our volunteers and our energy and our members where there's going to be the most impact. That being said, if there's a lot of requests to start a group for a specific area because there's energy to be active and to build relationships with your future MLAs there, we're happy to get those going. So just send us an email at the info@account, and we're happy to create new groups. So that was just kind of our starting point, was based off of those boundary assessments.
Yeah, it's really tough to narrow it down, just because there's so many ridings, and with all of the boundary redistributions, there's a lot of balls in the air as far as swing riding. So yeah, if there is an interest, we can expand our reach a little bit for some more Okanagan ridings.
So yeah, there was some interest in some of the, climate is really important. I did focus on some of the pieces on home support. So people who should receive home support, and this is a should receive because we know that it's kind of it's capped by the copay. But people who should receive home support are the most at risk for dying during extreme weather events, especially heat related weather events. So during the 2021 heat dome, BC recorded temperatures that were 20 degrees above normal. The majority of the 619 people who died during the heat dome were individuals who should have been receiving home support. So that was a high number of people who were over the age of 70 who had registered disabilities, chronic illnesses, and lived in like buildings, multi-unit tall buildings, and just other kind of indicators that would these would be most likely people who lived alone, who would be receiving home support or should be receiving home support. And the British Columbia Coroner Services held a panel to review the deaths and recommended of the two recommendations they made, the recommendation to integrate home and community care services in emergency preparedness plans as a measure to prevent deaths during future heat events. And I mean, and just to even give you a little bit more background, a lot of home support workers were basically put in also very dangerous situations. They are often paid wages that don't allow them to drive cars with air conditioning. And if they brought up the safety issues that they were experiencing because the heat, it was a heat emergency where everyone was told to shelter and do things that would reduce your internal heat. They were told to just not continue working or to suspend their own services, and often weren't even given avenues when they were seeing their clients, like having to leave their clients in like very high stress, high heat places. So just along the board, this could be, it's really important. And just to know that, as people mentioned, like we are only headed towards, unfortunately, the world is only headed towards 1.5 degree increases in the next decade. And it just means that more extreme weather events will become more severe and more catastrophic. And though I focused on heat dome related, there's flooding, there's wildfire smoke. And so just knowing that, the care economy of that's not just a workforce that it isn't based in fossil fuels is also something that helps mitigate some of the impacts that we're already going to be experiencing around climate change.
Cool, thanks, Angie. I see a hand up on deck from Don Peters. Go ahead, Don.
Thank you. I have to say a couple of things. One is what an extremely useful session this has been this afternoon. And secondly, and so I thank you for that. Thank you all for all this information. I'm very interested in knowing, I had to step out for a phone call just at the end of the quiz game, and I think I may have missed what you were telling everybody about how we can get access to a lot of the stuff that you had on screen, the 6 solutions, for example, and the supporting documents. Would you mind mentioning that again? I think I heard something about providing a link, and but I may have missed it.
Yeah, totally. Thanks. If you have a question, I'm sure others have it as well. So there is a page on our website that has all of our elections campaigns related material, and we'll upload more as we go. I can put the link back in the chat again. The main one that we want people to pay attention to today is the action toolkit, and within that page and that toolkit, there are links to the 6 solutions handouts, to the questions for candidates, and pretty much everything that we've covered today is in that toolkit. So I'm going to put that link back in the chat again.
Okay, thank you very much.
Thanks, Don. I see Ramona's hand is up next.
Yes, good afternoon. What a great presentation. I just want to make everybody aware that the Canadian Association of Retired Persons, CARP, I'm the BC Chief Advocacy and Communications Officer, and we have crafted a CARP 5 asks of all candidates and parties in this coming election. And I put the link in the chat. And also you can go to www.carp.ca and look for the BC CARP 5. And ours is very, very similar to yours. And I salute you on what you're doing. It's absolutely wonderful because we need to fix healthcare now. Everything is getting absolutely dreadful. I had to have my own MRI when I had to have a hip replacement a while back. My doctor wouldn't get one for me. I had to pay privately, and it's a fortune. Also, shingles vaccines, all kinds of vaccines. That's another thing that CARP is advocating for, because they keep seniors and older adults out of hospitals, out of emergency rooms, and keep us far healthier. So that's just a few of the things I wanted to point out. Again, thank you very much for this great presentation.
Well, thanks, Ramona. And it's so good to hear that there's alignment in other organizations' work and what you're asking for from candidates, because that does really help all of us have maximum impact. I think probably on a similar note, Diane's hand is up next. And if you have something else to say, Diane, maybe you can mention a little bit the work that Costco's doing in this election as well.
Thank you very much, Audrey. I have posted on chat two sections dealing with the actions that Costco is taking. The first one I posted is to speak about our Costco news, which we issue regularly, where we've had an election committee working on this, and we have put together an 8-page election insert in the Costco news. Basically, our goal, because again, we are nonpartisan, but our goal is to get out the vote, but also to get out a vote with informed voters. So the first part really gives a lot of information about the importance of registration and voting dates, et cetera, and changes in electoral districts and all that very important information that's on the Elections BC website. But we've designed the insert so that it can be pulled out and used for people that are wanting to meet with their MLAs or contact their MLAs or those candidates running to ask the questions on what we consider the very important areas of the work that we have been advocating on. So we have a website. On our website, we are also posting, like you, we have an Elections BC area where people can go to and check on updates for the elections and view the information that we've sent out. The second communication that I posted in chat was regarding that we have also sent out to the parties. Mind you, this was done before. The parties defined before merger, whatever you want to call it, happened. But we have sent it to ask the questions of the parties that were in the legislature. And the areas that we are concerned about being and are advocating very hard for: health, housing, income security, transportation, and human rights for older persons. That, of course, is in relation to the convention we're trying to work towards for human rights for older persons, that UN convention. So we will be putting the responses we've received from the parties as they are now and communicating that out. But all of that information, you can go to our Costco news. So the areas that we're dealing with in the election BC are under health or long-term care, home support. Those are the questions we're asking about. And then, of course, and vision, mobility, and hearing needs. And then we go on to the issue of the housing, income security areas, transportation, and the human rights. So that's a brief summary, but people can go to chat and go to our website to get the information. And if you want paper copies with the inserts, I've also indicated Linda Forsyth, our membership secretary, can get paper copies of the Costco News with the insert for your organizations or yourself. Thank you very much, Audrey.
Yeah, thanks so much for sharing, Diane. My little plug for that, the Costco newsletter with the elections insert is that it has the information in there for how to find out which candidates are running in your riding. And that's really handy because many candidates have yet to be announced. What we're expecting this election is that several ridings will have independent candidates, and there's a lot of unknown yet. So I'll encourage you to use that resource from Costco if you want to do some homework and identifying the candidates in your riding, because that's a really important part of the steps that we're asking you to do today.
I will post on chat the website that people can go to see who was nominated in their riding. Even
better. And you know what? That's a reminder to me to add that to our toolkit, and I'll do that this week. Still, that's always have things to learn from others. I think I saw Larry's hand up next. Larry, are you with us? And you're on mute.
There we go. I was muted. Pardon me. Okay, pardon me. I'm back. Can you see and hear me? I am here. I promise. Again, just to follow up to what Diane Wood was saying, we're in a very unique position this year. We're going to see in British Columbia an unusual amount of people who are running as independents, and these are qualified people who have left their party for reasons which probably support a lot of what we're trying to get through. We must reach them, and rather than ask them, just sort of ask them for a certification that they are on board with our platform, never mind their platform, because I really sincerely feel that these independents are going to get together, if there's 5 or 6 of them, and will form the balance of power, and we're into the next 4 years, we'll see more action than we've seen in decades in this province, and action in the right way. So please don't underestimate these independents. We are really, we have to bring our message to the people who will make the decisions, and it could very well be someone out of the parties. Don't underestimate them, and let's get this message to everybody running.
Yeah, that's such an important point. And you know, the role of independents, or even like minority parties in opposition in government, can be really powerful. So that's something that we're paying attention to. One of the things that we're not yet committed to, but are interested in, is in those ridings that we are going to be encouraging people to get involved, especially if there's independent candidates, maybe putting out a specific report card for that riding so that we can capture some of those independent voices. Now, I say that we're not committed to that because a lot of it depends on when those candidates say what they're about, what kind of report backs we get, and what timeline we can work under to create those individual writing report cards. Now, definitely we wouldn't be doing it across the board because there's a lot of ridings in BC, maybe some specific battleground ridings where independent candidates might really make a difference. We might take a look at that. So definitely, if you are a constituent in a riding that has independent candidates, please do approach them as well as everyone else and report back everything that you learn. If you're, and one thing I didn't mention earlier is if you're not in one of the ridings that we're paying close attention to this election, but you're kind of close by and you want to pitch in, please do consider pitching in one of those other ridings, because those are the ones that are more likely to have an impact on the outcome of the election. And so that's another encouragement, that if there's not a group for your specific region, please join the one that's closest to you if you're interested in supporting the efforts there. Thanks, Larry. Larry, I see you talking about your back on mute.
I'm sorry, you're saying it's one for all and all for one, and that's really, really factual. We're really focused on something very important that affects every single senior.
Yeah.
And we are a force. We are a voting force as well. By the way, if you could, I know Dan's away, but the senior advocate office sends a newsletter out every month, every Monday of the first Monday of every month. I spoke to Dan Levitt's right-hand gal. She's, I forget what her name is Susan Lewis. Anyway, really nice woman. If there's something you want to get in, his newsletter goes out to 5,600 seniors organizations. Even if it's to get your email, your website, your reference here, that's all they need. The rest takes care of itself. If you want, I'll send you Susan Lewis's coordinates, and you can ask her. It's a one chance, okay? Because it's the next is the last first Sunday of a month before the election. So you don't need you need something that just bring them to us. We'll take care of the teaching. Just get that link through, and this covers the entire province. I'll send it to Audrey, okay?
All right, thanks. That sounds worthwhile.
Good. It's something you should know for future reference to. It's a good organization.
I saw this happen in the chat. I just wanted to draw attention to it. Megan did mention in the chat that in addition to the WhatsApp groups, we did create a specific Facebook group that's called BC Seniors for Public Healthcare, I think. Is that right, Megan?
Yeah, it's BC Seniors for Public Healthcare, or BC Seniors for, yeah, okay, I've got it open right now. That is free to join, and we're collaborating with a lot of the other seniors organizations that are part of the BC Health Coalition as well. And the idea is that we're pretty aware of the fact that a lot of seniors don't want to add an extra app to their phone, but many of you guys are on Facebook, and it just happens to be that Facebook is a really tough place to get organic traction on. So when we post stuff there, if you're able to share it within your network, it makes a huge, huge, huge difference. So we wanted to build a bit of a community on there. And just one other note as well, we're encouraging folks to join the WhatsApp group that's closest to where they're at. And even if you're quite far away from the ridings in question, a lot of the work that we're going to be doing is going to be like digital recon. We're looking for events that candidates are going to. We're looking for local news, which is a lot harder for us to source ourselves. So if something makes the news in Langley, Willowbrook is a fantastic example of a candidate that has some pretty wild opinions. The BC Conservative candidate has a fake doctor degree. Those are the kinds of things that we want to know about, and you don't necessarily have to live in Langley, Willowbrook to get us that information. You can just be keeping tabs on those candidates. You could follow them on social media and report back to us when they say something that contradicts our message, that kind of stuff. So you don't have to be in that riding. And even if you're a couple towns over, just join whatever group you're closest to, or if you notice that some of them don't have very many members, maybe we'll do, if we notice that some of them don't have very many members, we might do a call out, just seeing if anybody else wants to jump in. So yeah, thank you so much for letting me talk at you one more time.
Good. There was one more thing from the chat I wanted to draw attention to, and that was a comment about all candidates meeting that had a candidate, I think it was from the Conservative Party, not attend. Yeah, so here we go from Patty. Sibiamu seniors had candidates town hall already. 97 folks came. Conservative Surrey South Conservative MP's husband no show. Here many areas there are many Conservatives that are not going to debate. And it's possible that there will be candidates that aren't really responsive when you reach out. And that is actually something that we want to know, and we encourage you to report back on, because if people in their writing are reaching out and asking for clarity on their positions and they're getting no answers, or they're putting together events and getting no attendance, That's something that the public deserves to know, that these candidates aren't willing to take a position on these issues. So we want to know when you get ghosted or you get no responses, because that's part of educating voters about the positions. And maybe it means that some of the report cards have blanks in it. Like we can say this party hasn't clarified their position on this issue. And it's important to communicate to voters as well. So I wanted to draw attention to that. Anything else that's popping up? Yeah, Angie, go for it.
So there was a question about when the report card would be released. And so I just wanted to clarify how it's going to work right now. So as planks are coming out, as politicians are making comments, I'll be working to, you'll be seeing them in your email boxes. We'll be just doing kind of these mini report cards on what they're saying, and using, that tool that we used in the game show to be like, this, just to clarify, this is quackery, this is an infusion. And then at the end, closer, and I don't know if we have a concrete date, I think it would be, we'll release a report card closer to the election, maybe a week before, or 2 weeks before, once we have kind of all of these kind of feedbacks and this work done. So there'll be something that's a little bit more evaluative overall for the parties that we'll actually release, but till then we'll be doing kind of mini assessments on things that'll be coming up.
All right, thanks, Angie. Anything else, or folks who are keeping a close eye on chat, is anything coming up there that we want to highlight? Okay, so I'm going, oh, did I see a hand up?
I was just wondering, Megan spoke about doctor without a legitimate certificate that he graduated. I'd like to ask her, is he any good?
Her name is Judy Tour, and she has a doctorate in energy healing.
Oh, okay.
So we actually made a great Instagram video kind of covering that, or I went through and covered it, because the school that she went to has a really big disclaimer saying that they don't stand by any of the things that they teach, and that they're in no way accredited by any like metric at all whatsoever. It is pretty wild. And just very quickly, the interesting thing about the Conservatives is when they selected their candidates, they did not expect to be potentially a governing party. So there are a lot of candidates who were never supposed to be taken seriously that are now potentially going to get elected, and Judy Tour is one of them. And she's one of the reasons, she's the reason that we actually have selected that riding for the most part, because we do have someone who's such a huge risk to health.
Wow, but we've got to beware. I mean, this applies across the whole province then, regarding the Conservatives. They didn't think they were going to win. Very interesting. That's a big message. Audrey, that's an important message.
Yeah, and there is that WhatsApp group that is province-wide updates. So if you do find that your local candidate in your own riding, even if it isn't one of the ones that we're focusing on, says something really wild about healthcare, we do want to know that as well. So if they do say something very specific, like maybe if they recommend some sort of sketchy supplement and say that they're going to make sure that that's covered in the healthcare system, those are the things that we want to know about as well. So if it's really relevant to our work, we want to know that, even if it's not in one of the ridings that matters.
Precisely. Excellent.
All ridings matter. That's not what I meant. Even if it's not in one of the ridings that we're specifically doing work in.
No, our message has been carried. This is what's important in the Legislative Assembly, of course. Okay.
Okay, so I think we are pretty close to being done here. I'm just going to wrap us up. Thanks everyone for your discussion and inputs, and it's so good to hear about what other organizations are doing. Here's my slide that I want to talk about, just a little bit of a recap. So after today's call, we're going to be sending out the toolkit by email and the vote pledge by email over the course of the week. If you're a member organization or an organizational member of the Health Coalition, your communications contact will also receive a partner toolkit that will have sample emails and graphics and whatever and a bunch of things you can choose from that helps you communicate this to your members as in the way that you usually do. So please be a lookout for that. We're also going to be sending out a little bit of a timeline of those toolkits so that you can plan ahead and know what kind of information we're going to be sending, giving you the option to share with your members. And you can pick and choose whatever makes sense to your organization. But the main one is please to sign the vote, to send out the vote pledge, because that's kind of like our point of entry into our campaign. And if your members sign the vote pledge, we can send out the toolkit, we can send out volunteering opportunities. And so it's kind of like, if you're going to pick one, send out the vote pledge, please. So here are our next steps. Join the WhatsApp group and sign the pledge if you haven't done so yet. The Facebook group for seniors, please join that. And maybe Megan, can you just pop that link in the chat one more time so it's fresh at the bottom as we're wrapping up here? Thank you so much. And our next meeting is going to be our How to Talk About Healthcare workshop. I think that's coming up next week. So Megan, I'm going to put you on the spot and ask you to put that one at the bottom of the chat again, but we'll send that out in an email as well. And then please do sign up to volunteer. There's a sign up form on our website, but if you sign the pledge, it'll automatically ask you if you want to volunteer, and please do so. The other thing to look out for is our more public media launch of our platform. We are working hard to get that out there this week. And so we'll be sending out some updates when that's released and updating the website so it's available to all of you. For those of you who are really into well-designed policy documents that break down many, many more things than just 6 that can be done to improve our healthcare system. We'll encourage you to take a look at that and share that. I think that's it. So I'm going to, for those who have the patience to listen to a Tommy Douglas quote, this one is maybe quite famous. It's from a speech called The Future of Medicare in 1984.
Tommy Douglas.
And we're going to wrap up with some words from the founder of Medicare. So I'm telling you that unless those of us who believe in Medicare raise our voices in no uncertain terms, unless we arouse our neighbors and our friends and our communities, we are sounding the death knell of Medicare in this country. And I, for one, will not sit idly by and see that happen. Let us not forget that the ultimate goal of Medicare must be to keep people well rather than just patching them up when they get sick. And that means clinic, that means making the hospital available for active treatment cases only, getting chronic patients out into nursing homes, carrying on home nursing programs that are much more effective, making annual checkups and immunization available to everyone. It means expanding and improving Medicare by providing pharmacare and dental programs. It means promoting physical fitness through sports and other activities. That is the legacy that we are part of, and that is still what we are fighting for today. So let's get to it. And thanks, folks.